Yes, Susan Parsonage, Charles Margetts, and Karen Buckley.
Yes. Thank you. Okay. The minutes of the previous meeting. I hope you've all read these. Has anyone got any comments on the minutes, or can I accept them? Okay. Any declarations of interest? No. And there's no public or member questions, I don't think. So, are we doing transport first still? As our guests are here, we can do social care futures first. Social care futures is an initiative I'm very proud to have been personally involved with for at least the past year as executive member for health, wellbeing and adult services. It's been part of my dream for almost, well, probably over 40 years, that people with disabilities are treated as equal people, and that's the important thing. And I really do pray that this time the initiative really gets listened to and acted upon by everyone, so that we can really go forward as one people and not a differential lot of people. I'm sure you all know Matt Pope. With him are Hilary Lovey and Callum Bell, and there, I can't say that actually. But so yeah, and Hilary is the co-production and engagement officer, and these two are people who use our services. And they're here today to talk about three things: the Social Care Futures movement, the vision our adult social care team has for the kind of support we believe we should offer the people who live in our borough and who we work with, and the charter that describes how we should go about doing that. It's a vision that's, I believe, all about changing the perception of adult social care and finding a way to ensure people who draw on support are central and key to the process. It requires us to reimagine and reinvent what we do and how we do it as a council, as social workers, as a community, everyone. It isn't just social workers, it's everyone must do this. And it's important that it doesn't just stay in this building, but permeates out into the whole borough, because I think that's the way that we can go forward. Today, Matt will be asking for your endorsement of the Social Care Futures vision and charter before we go to full council in January and ask for it to be formally adopted. He and his team would like your support for this in making the care it describes a reality in our whole borough. And we do know that there are obviously some limitations to what can be achieved because of the finances. We ain't got a pot of gold, we ain't got a money tree. But I believe that a lot of what Social Care Futures is about our way of working, our attitude, how we treat each other, how we treat other people. And that, I believe, is the important thing. And yes, we want to realise the gloriously ordinary lives. That's quite a catchphrase for Social Care Futures, for the people who we serve and everyone in the borough. So I believe now we're having a short animation, and before Matt will tell you a bit about Social Care Future Movement and our vision, and others will have a go.
very good scrutiny. Then the same room.
I know, I've literally got like a curse on this bed. We were just check you there. Yeah. Yeah. It does come out in double, I'm afraid, but part of that one we have much to resolve.
We all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. But for many, this is not reality today. And without big changes to the way we think about social care, many more of us will face losing control over our lives and contact with the people and things that make our lives worthwhile. It doesn't have to be this way. At its best, social care helps us to find, grow, and weave together the people, places, and resources that we can draw upon to live where we choose, in the way that we want, with meaning, purpose, and a sense of belonging at every age and stage of life. Realised through innovative approaches like circles of support, shared lives, and gig and sports buddies. We need this to be the reality everywhere and for everyone. To do this, our government needs to invest in social care, and our local councils must work with the people they serve, so creative approaches can take root and begin to thrive. Let's start growing the social care future together, for all our futures. Share this video and join our movement for change.
You, Matt.
I think David and the video said most of it already. I think we know across health and social care, the system is really, really struggling, and just simply trying to do more and more of the same just isn't going to work. So we've been at this for about a year or so now, haven't we?
Yeah.
We've signed up to Social Care Futures. It's a national movement or collaboration and network of trying to do things differently by really listening and sharing power with people with lived experience of social care to do things differently, to try and reduce bureaucracy, change supports and services to things that make sense in a system sometimes that doesn't to people. What we're looking for today, because part of that, we'll talk a bit more about the work we've done, but part of that is we've written a charter. We want that charter to come today, and then we want to take that charter to full council in January, and hopefully people will sign up to it. I'm not saying any more than that, because I know Callum and Jay want to talk a bit about their experience of social care and how I think you believe that this might change things for the better. So I'm going to pass the mic over to you now, Callum, because I know you've always wanted to speak at a council meeting. He has to.
Yeah. Thank you.
We had a couple of bit of chat, didn't we, before today about some of the things that we wanted to cover.
Yeah.
So I guess the first one was, I think you talked about something about how the system is complicated.
So at the moment, the actual front door system is quite complex, and when, say, you move areas, it should be more expedited, because you need to because at the moment you're coming from Reading, and Reading go, and Wokingham go, okay, and then Reading go, oh, sorry, we don't know that person, or we're not going to give you that person's details because it's a GDPR, but it should be a thing, or it's like, as I used as an analogy, girls falling out on a playground and
Nobody talking.
nobody talking. Yeah.
And then another thing I think you were saying was
Yeah.
tricky was when you left college.
Yeah, when I left college, there was no sort of transition from doing, because when you're in education, you have the education and healthcare plan. There needs to be something in place for people leaving education that is like the education and healthcare plan, where that we can move them over onto that thing, so that then when they meet their social worker for the first time, their social worker knows what the problems are. Like, say because when I was at my primary school and secondary school, I was under the sensory consortium, but when I left that just disappeared, and then my mum had to jump through loads of hoops to get that all sorted out again. So we had to go first to the doctor's surgery. They sent a referral out. Then that referral they first sent it to the hospital, sent a referral out to go to a clinic, but because they didn't change the address, it went to the old address. That then bounced back, and then they went, oh, he's not coming. And then it kept bouncing back. They kept sending it out. It kept bouncing back until my mum called them, but then it went through to a company called Health Harmony. They went, welcome to Health Harmony. We will sort you out.
Yeah, we definitely heard, didn't we, from other
Yeah.
places as well. You were saying your
Yeah.
mum said you felt like you'd fallen through
Yeah.
the cracks of
Yeah.
it.
Falling through the cracks, yeah.
And we've had in other research we've done that often people find that transition a real cliff edge and a time of great anxiety. One of the other things I remember you saying was important to talk about was transport, I think, isn't it? Some of the challenges with
Yes.
when you have disabilities.
So, first off, with regards to the transport, the current concessionary disabled persons bus pass system is very, what's the word?
I think you said the word desert when we were
desert, but I can say, and it's also very discriminatory against young people like myself who are trying to get jobs when they say, oh, you can only travel that far from off peak when you're working. That is not technically correct, because you can't say to an employer, call up an employer and say, I can't come in until past, so they'll go, your shift says you start at this time, you need to start at this time. Because they would probably then go, oh, because you keep turning up late.
So there was the bus pass times. Then was it about
the actual? This covers a multitude of the routes provided by Reading Buses and Thames Valley, which is the 128, the 125, and the Route 3, which Route 3 affects me because I live in Arborfield. So if I'm going to work and I miss one bus and I have to be there by 9, that also is the problem, the bus pass, because I had to leave at 8. If I miss the 8:21 bus, I had to wait an hour for the next bus. So basically, living in Arborfield, you get a good service to Reading, but you get an abysmal service to Wokingham.
Yeah, definitely.
So
the theme of transport comes up a lot
when
we speak to people with disabilities. And then some of the things on the positive bits though. So you've talked about work a couple of times.
Yeah.
So, do you wanna...
So basically, a good thing is the help that Optilis have provided to get me into work and help me get into the workplace. But it's still a bit hard to get because with the interviews, sometimes they're quite, because you can't really show yourself across to the employer because with learning difficulties, it's quite hard to present yourself as someone without disabilities is in an interview. So you're more likely they will then, when you go into if you get to, say, the shortlisting bit, but then you get to the in-person interview, the interview then looks at the thing and you go to the interview, you don't put yourself forward enough, and then, or you don't show them, and then the employer. So interviews in the way they are conducted at the moment are quite predatory. So they need to maybe within this charter we bring up, maybe that is one thing that we need to work on, is getting the employers around the table and saying that they need to change their interview practices to maybe doing trial shifts, which would be a better way of going, oh, that person is really good for this job or not so good for this job. I know certain employers, they will go, but we need to still do the shortlisting, but maybe when we've done that would be an onward chain, an onward thing, that you go onto a trial shift and you do, if they have to do an assessment, or they do the assessment through the trial shift.
I think definitely can see how the topics here cross lots of different areas of council work. And maybe just, you mentioned the charter at the end, just wanted to think about what being part of the social care future movement has meant to you.
But basically, I feel that the co-production within the social care futures framework, which is it's not just a thing, it's just a regular meeting, it's basically a movement we're part of, trying to get social care to the point where it's not, as I keep bringing up in the meetings, like the government doing their sticky plasters, going, oh, just throw money at it. They need to think, not just throw money at it, because throwing money at social care isn't the way forward. They do need the money, but it is.
Thank you.
but it isn't. But that is not the way to fix social care. The way to fix it is to do a complete and utter build up from the bottom again. Because at the moment, it's from the top down, not from the bottom. It needs to be from the bottom out, not the top down, which is at the moment how it's worked. And every time it comes up in government budgets in Westminster, it just seems that it's always a footnote. It's not a major thing, social care. They go, oh, and here's something about social care. It's just a footnote in every Conservative budget from the last 3 or 4 chancellors. Social care has just been at the bottom of the list, because they go, oh, defence, then they go, oh, education, but then they go, oh, there's not very much money left, and they go, well, which department needs to take the hit and cut? And it goes to the Department of Health and Social Care, which means that Matt gets less money from that part of government, but also they also cut funding to local government.
I think.
Yeah.
I think hopefully so.
Yeah.
Thank you.
Yes. Yes.
Certainly also start bringing up some of these topics about
the
importance of as you say, hearing people's real life lived experience to help solve things.
Yeah, that too. So
handing over to Matt.
If Matt wouldn't mind.
Is Jane up speaking?
He is, but he's got his assignment of doing. It's spreading people out. So we've had a little bit of chat, some of the things that we're doing already.
Yeah.
So if you want, I can. So it's just we want to then talk a little bit about some of the things that we're doing, because Jay's also been involved in some of those.
Yawning.
That's okay. You've got a couple of, you've got about a slide warm up, Jay. So it's to say we've actually started to make some changes. So in the system at the moment, and some of the ways we're trying to work differently, inspired by the vision and the charter. And we just want to talk to you a little bit about some of the things we've already done. So we're part of the Social Care Future movement, which means we have a community of support. So we are in contact with other local authorities that are also trying to make this transition, so we can learn from each other.
And Impact, don't forget that.
Oh yes, and we're also involved with, we've got a project that's been sponsored by Impact, who are also trying to help us make better decisions involving people and data. We have a social care future group. You should probably spot some of the familiar faces there. So we have a group that meets monthly, and this is, yeah, you guys are both on it.
Yeah.
See Dave there as well. And so that's people from across the whole sector, includes social care, health, voluntary, community and private sectors, people with lived experience of care, and that's been meeting monthly since May. And the aim really is to try and help us embed the change, to keep us going with our momentum on this, and to kind of work towards the vision of an equal life. So we've been out and talked to the community. So there was an event in July, called a big gathering.
Yeah.
Again, a number of
which also a few months back before then, we also went to one in London, which was with the lady who was doing Hillary's job before came to, which was, I can't think of her name. Jodie.
Yeah.
Jodie and the other lady who lived in.
And Carol.
And Carol who lived in Kent.
Yeah. So we had a big event as well. So we went to one in London, which was really inspiring. Everyone really enjoyed. Yeah. And so we had one here.
So we invited one group called Camarados.
Oh yes.
Which did the outdoor sitting room, which loads of people liked.
Yeah, just to get everyone together, wasn't it? And to get talking. So we had lots of different things. Over 100 people attended. There were things to do, things to learn, people to have their say. And it was about.
Bless you.
So, and it was delivered and participated in by people with lived experience. And we actually, at part of that, started thinking about our vision and the charter with that group of people, so we could start co-producing. And I thought then we've got Jay to say. Jay's prepared a few words, I think, very organised. You've got some lovely photos there.
Good joke, Dave.
Oh, I know.
Yeah, and one's party and one's work. So a bit about me. So my name's Jay. I work for Optilis one morning a week, and I also use Optilis services. I live with my family. I get support to do my job. I get support during the day to do the things that matter to me. I also use the short break service to give me and my family a bit of a break from each other. And this is now the next bit, how I'm involved. I have been involved in social care futures since the start. I go to the social care futures meeting and we talk about what needs improving. It's a friendly meeting where people are treated with respect. My views matter and I'm listened to. I would like more people to get involved in social care future because it's a great way to work together to make things better. And last bit, why it's important. For me, social care futures is about equal opportunities. It's about a community that is accessible and includes everybody. It is about me and my friends being able to live the life we want to.
Matt?
It's just to say we have started embedding.
I mean, just to give.
Oh.
Yeah.
Some of this is about vision, and if we go back to the slide quickly, one before. Yeah, that's it. I mean, some of this is about vision and a charter and change, cultural change and thinking and doing things differently. But I suppose a small practical example of that is we were investing some money in a new carers service. We went out to tender the council with that, and we just did that in a really different way. We included people who really knew about caring and what that meant in the whole process, and evaluation and specification, and we ended up with a really different outcome. We had the organisation or organisations that got the contract in the end were a kind of collaboration of local organisations that kind of came together to really listen to the people who lived experience through that process. And I suppose it's just a smallish practical example of what that vision and change might mean in reality, and how we might do more and more of that over time. Well, I think we'll move through that. I think that slide really about language was just some of the problem with social care is all the language that you get about it, particularly in the press, is always very negative, isn't it?
There's always, this is the fault of social care, not social care, and there's always social care needs to do this, not social care.
Yes, or it talks about people having needs and problems and being vulnerable, as opposed to people who have got great things to add to communities, and like David said, gloriously ordinary lives to lead. So it's moving away from that and trying to change that and reframe that. And here's the charter, or your charter. This is what we want to take to council to adopt, and then to come back with yearly updates really to council. And we've got a website that we want to launch. I'm on the last slide now, and I've shot on. We've got a website that we'll launch alongside that, and we're looking for people to sign up and create a snowball effect. It's Christmas time, and it's a snowball analogy works quite nicely. So that's the kind of that's where we are, isn't it? I think. Thank you.
Thank you very much, and thank you especially to Callum and Jay, because it's never, well, actually both of them quite enjoy talking, so I don't think they found it that hard. but it's still quite daunting in some ways, talking to new people and so on. So thank you very much indeed. We've got some recommendations which we need to vote on, so I'll just read them out. Oh, sorry, Stephen.
Just before you do, I'd just like to also say a big thank you to Callum and Jay for coming and speaking this evening. What you said was very powerful, very revealing, and incredibly articulate. Both of you spoke incredibly well, and really found it very helpful to learn about your experiences. Really helps, I think, a lot with the way we try and do things better in the future. So thank you both very much.
Susan wants to say something as well.
And thank you very much for that, Jay and Callum. That was really, really fantastic. I'm the Chief Exec at Wokingham Borough Council, and I'm really, really interested in what you've said. And as Stephen has said, you said it so clearly and so articulate, and gave us really great examples to really understand, the issues that you or your family, have to navigate. So it's, really, so thank you so much. And certainly, I'd be really interested in, I'd really want to come to the social care futures group. And I love the strapline about the gloriously ordinary living life. I've got it wrong, sorry, but I just love the strapline. That's it. Yeah, sorry. So really, fantastic, and thank you so much. Really, really powerful.
And I should have said, I'm Stephen Conway. I'm the leader of the council, so I'm the political side of the leadership of the council. Susan's the professional side. She knows what she's doing, in other words. But I would also be very happy to come to any of your events and meet some of your colleagues. And obviously, we're looking forward very much to your charter coming to full council.
Alice, you want to say something as well?
Yeah, thank you. Can you hear me? Yeah. Callum and Jay, thank you very much for the presentation. It's really good. And just wanted to find out from Matt and Matt, how are you going to put it out to the public as such? When are you planning to put it out, and so that we can celebrate this amazing charter? So that's the ask, because I do think the public needs to know this is happening, and and also embrace it, because this is all part of belonging, isn't it?
Yes, I think the simple answer to that is we're going to full council in January, which is obviously quite a public meeting, and then we'll have the comms and the website launch after that, so that people can sign up to the charter, and that. So getting it out there is going to be the real focus of next year. This year was about putting the foundations in, having some initial meetings, and working on the charter. So it's coming, Alice, don't worry.
Yeah, it's not. It's just the fact that how the materials are going to come out, because a lot of the time as council, you say the things are happening, but the public don't know. So we need to, this is so much, this is a positive thing. And I think, we need to make a little bit more effort when it comes to the comms. That's what my ask is.
Sure, yeah, I mean, we can work together, and I understand what you're saying. I think one of the ideas is we'll use the council's distribution system, so every household in the borough will hear about it, which will be a good start, wouldn't it?
Yeah. Thank you.
Okay, thank you. Oh, yes.
Thanks, and I really echo the sentiments that colleagues have made here. When I was just looking at the charter itself, I felt that the changes we want to get to, the 5 changes, are really important, and I felt that really came out in the discussion. And I did just wonder about whether the things that we were doing to bring about positive change needed to actually recognise. They felt to me that there was a lot of listening going on in there, which was right. But I wondered whether there just needed to be something that said, and because we've listened, we're going to actually do. And I felt I'm not sure that we quite got, well, my challenge is, I think you've got to listen and you've then got to do. And I'm not sure we've quite nailed the and do part in it.
Yeah, I just think that sort of reflects the stage that we're at. I mean, there has been quite a bit of doing. I don't know if it maybe didn't come out in the presentations. A new carers contract. We're redoing the front door, the impact work in terms of social care, direct payments. We've done a whole kind of reform of that with the group. But I suppose having the charter, going public, getting more people involved, and then going back each year at council to give an update on what's happening and what's changing. It's that kind of snowball.
So it definitely came out in the presentation that you are doing. It was just how do you get the richness of doing out in the one page?
Yeah. Any suggestions? We're welcome with that, because we struggled. We had a document, didn't we?
Yeah.
And that looked a bit like a council strategy. No one liked that. No one liked that. We then went.
It wasn't worded as
back.
we wanted.
But it is a bit of an issue with this, trying to communicate a change really to people's hearts and thinking and minds, but then get across what that means and what we're actually doing without that getting too long-winded.
Yeah.
So happy to take help with that.
Just wanted to make one
one point, which is I went to that event in Woodley in the Oakwood Centre, which was very good. The message that came across to me from that very clearly was that people's vision for the future in Wokingham was of a place where everybody belonged. But that's exactly the same, really, as the wider council vision work that is going on. The community vision for the whole of the community. So what I don't want to lose is the connection between the two things.
Yeah.
So we have to make sure that this is integrated into the community vision, so that we've got everybody in the community included, which is where we want to be.
Yeah.
Yep.
Yes.
Hi, I'm Debbie Milligan, a local GP. I think the work is absolutely amazing, and I would like to almost see it's like a gold standard. You know, for years we've been talking about when we look at different services to do things differently, we should talk and engage the people who are in the services and see the good things and the bad things. And we try, but we usually don't actually achieve it. Or we listen and health and social care, whoever we are in our little boxes. And if you don't fit in, then as you say, you just kind of fall between. So I think it's a celebration of the whole group that, yes, people are listening, but you're also acting and changing. And I think that's incredible. And I agree with Prue is, you know, your vision of being part of the community and living our lives. We all want that, but I think for me, I'm holding you up to go for it, guys, and the rest of us will be able to kind of celebrate and lead better lives because of you.
So that's the thing. So if any of you want to, you can, if after we've, as Matt said, brought it to full council and got it, would any of you like to then join our central group so we can maybe get, say, from a GP like yourself or from other areas to just come and so they can come and sit in on our meetings and actually help us move this movement forward. Yeah. Yeah. So thank you, Dr. Milligan. I know.
Bill, you want to say something?
Thank you, Chair. Yeah, you know, having been involved in this work virtually since the start, I too completely understand the importance of it, and I'm excited by the ambition that's been adopted, and it's been led very much by people with experiences, as we've talked about. I see, though, everybody in the Wellbeing Board as being the champions for this. I think it's more than just it is a way of being. It is a movement. I think that, you know, Callum articulated that incredibly well, and I see that we all now have a responsibility to embrace that movement and to be the champions for this, so that we do see the culture change that's intended. Thank you.
Thank you, Phil. Someone else got anything? I think everyone's said something, and certainly I'm very excited by what's happening, and yeah, believe that really it is a very strong movement to go forward, and it's people like Callum and Jay who will lead it forward, and there's other people who use our services who will lead it forward, and that's almost the most important thing. It isn't so much we want to support and we want, but people like Callum and Jay and so on who are holding the flag up. And thank you both very much for what you're doing as well. We've been asked to agree with the recommendations. They're up there. The one thing that I would encourage everyone to do, and I'm sure we all here would want to, is number 3, attend an hour-long briefing, because that's important that you really know. And yes, we've got a flavour of what's happening, but it'd be good to have sort of just, well, we had 20 minutes plus questions, 20 minutes. So, but yes, have an hour together just to find out about it and find out. And again, we'll have people like Callum and Jay, people who use services, or we've got a carer who's on our group and things like that, so that people who use services to help us to understand their position and where they're coming from. Because until you use a service, you don't really realise. Until I was in a wheelchair for 6 months, I didn't realise a little step that big was a mountain. But suddenly in a wheelchair, you've got to get over that. And you're pushing your wheelchair and you come against that. And in fact, it's quite difficult. Little things like that, I hadn't even seen it. So you don't realise things until you're part of it. So can we all accept these recommendations? Your support for social care future vision, adoption of the principles in the charter, attendance in our long briefing, and to be involved in our social care futures movement. All those in favour? Okay, thank you very much. And yeah, and thank you very much for all you've done and go on doing, both Callum and Jay. And okay. Yes. So, Jay, got your coat. Okay, now we're moving on to something that was very close to Callum's heart, and that's transport. And I think that's Robert.
Right, thanks very much. I've also got Steve Bailey on Teams. I think he's got a couple of slides to share. So for those who don't know me, I'm Rob Curtis, the Transport Planning Team Manager, and Steve is supporting me on this as our LTP lead. We've basically been spending probably a couple of years now producing the new local transport plan, because local transport plan 3 was actually adopted in 2011, so it's quite out of date. The reason we haven't updated it since then is because essentially DfT dropped the requirement to keep maintaining your LTP every 3 years. So it was obviously an area we could save time and money by not producing an update. But having left it as long as we did, there's obviously been a lot of change over the period. And so this is a complete relaunch, I suppose, of the local transport plan. Although having said that, a lot of the themes in transport haven't really changed. I mean, we still have issues with congestion. We still have environmental problems, although they're becoming much more important. But we do also have DfT changing their direction in terms of wanting to see more people walking and cycling, more people switching to electric vehicles if they have to use a car. And also in terms of buses, trying to get more people on buses and increase the use of public transport to reduce that congestion and number of people needing to use a car. So the reason we brought this here today is it's actually really good timing with the presentation we just had, because as Callum said about he had a bus on his slide, which is very exciting. And then of course he said they don't run at the right times, and the bus pass doesn't work for the times that he needs it to. And they're the kind of issues that we want to pick up on. And fairly recently we started working with Matt's team, and we've started picking up on those kind of issues, and we want to know more about those, I suppose, and what else there is that we need to kind of develop as part of the new local transport plan. So the local transport plan as it is, we have 3 kind of key areas or themes, which are to create healthy and safe places, grow the economy and reduce environmental impacts. So that creating healthy and safe places, it's very much, I think Jay just said, he wants a community that's accessible and inclusive. And that's exactly what we want as well out of our transport plan. So there's so many synergies there. We really want to make sure we're hitting all the right kind of health and wellbeing kind of points, as well as meeting DfT's requirements for the kind of transport plan that they want to see. So that's mainly the end of my presentation, really. You've got the whole local transport plan in the document. We do have a better looking version now because we're preparing this. There's the front cover on the screen. We're preparing one with pictures on that will be more accessible to the public and look a bit easier to read. And at the end of that plan is the action plan, which has a number of different actions on there. A lot of them, because this is quite high level, it's proposing new strategies and kind of new sort of future actions that we need to take. So we'd like feedback on the action plan itself, not necessarily tonight, but throughout the consultation period. Consultation is planning to start on Monday now. We're going to run it for 9 weeks, so we've extended that because of the Christmas period. We want to give people the opportunity to give us as much feedback as possible, and we also want to go out in January and February to various groups and as many people as we can, really, to present our ideas and our thoughts and get feedback from sort of various groups. And that's the other area where we really want help, probably from the Wellbeing Board especially, is how do we reach those hard to reach people? We traditionally obviously use Engage, social media, and newsletters, that kind of thing. And we always get the same kind of demographic of response from kind of people who are a little bit older, possibly retired, and have a lot of time to be able to respond. We don't get many responses from young people, definitely different ethnic backgrounds. Yeah, people with educational needs and that kind of thing. They're the people that just don't respond at all, and we want to speak to them, and also the carers and the helpers who need to get around the borough as well. So I guess that's the end of my presentation pretty much, but yeah, any thoughts on that would be really welcome.
Got Stephen and then Prue.
And thank you very much, Rob and Steve, for your work on this. Obviously, the executive has already seen the document. We've approved it going out to consultation. First thing to say is excellent choice of images on the front. I can see Twyford in the top left-hand corner, just where it should be, of course. The more serious point really is picking up on your really interesting comments about the nature of consultations and how difficult it is to reach certain parts of the community, quite significant parts of the community, actually. I mean, one of the flaws in the consultations the council carries out is that we generally hear from those who are comfortable with what they've got and don't want things to change. We don't hear from those people who perhaps would like things to change and would like things to improve. One way we could do this long term, it's not going to be, I'm afraid, an answer in this case, is think about a citizens panel or a citizen panel, I think, would be the best, which is truly representative of the different groups within the community, so that we can be more confident we are hearing the voice of those we often don't hear from. That's obviously a long-term aspiration. It's not something that's going to be relevant to this particular consultation, but it is always a challenge with consultations. And we're not hearing from some people who we need to hear from. Maybe in this case, following on from the presentation we've just had on social care's futures, that we've got to think about making this something that we can script the whole council to help us reach these groups. Really, Matt will be able to help reach some groups, but there may be other people who are able to help. And I think we have to think of this in corporate terms rather than just as something in your particular directorate. But thanks very much.
That's really good. Then, Phil, one thing I was thinking is, have you ever thought of going to secondary schools and things like that and get?
Sorry. So there's actually two things. Before I talk about engagement with young people, I don't know whether this is a fairly high level document. There's a lot of stuff, so I don't want to introduce something if it's inappropriate at this level. But what for me, which I should have noticed when the executive approved it to go out for consultation, but I hadn't thought of it then for some reason, and it came to me when I reviewed it again. This was that reducing the impact of roadworks is something that we could possibly do, particularly when they're not our roadworks. You can't prevent people digging up the road, but you can do something about, I think, a bit more about trying to reduce the impact of that on people, working with the utility companies. So that's the only thing where I could think of as a gap. But on the consultation, I would really advise that the way to reach people. There's a youth council, and there's also the Send Youth Council, and there's the Children in Care Council, all of whom have different views of the way the world is and how it suits them, and some of them will have quite unique perspectives that you need to pay attention to, but you don't really get. The other thing is you can easily reach the parents of 22,000 children by sending a letter via the schools, and I'm sure the schools will help with that, because we actually need their views as well. And what we tend to get is the older people who don't have school age children. Whereas if we can reach the people who do have school age children, I think it will be very helpful. And don't forget that as those are the 22,000 parents in our schools, we also have some independent schools who maybe we could also enlist in this, and nurseries and early years settings as well, because they have their own challenges about getting young children to school, or to settings, or to nursery, and those kind of things. And they might also have perspectives on travelling with very young children, which is sometimes a challenge on buses and trains, shall we say. So I would recommend all those routes, but I think it's a pretty good solid plan. As you said, the basic themes won't change, but I think the context in which you're doing this is quite different to the context of LTP3, and so there's a lot that the world has shifted, and there's quite a lot we need to do, but I think it's a pretty good document. Thank you.
No, thanks for that. Yeah, first of all, on the roadworks point, there is some work ongoing about road user charging and that kind of thing. Not road user charging, sorry. Charging for, yeah, I can't remember the term now. But yeah, that is ongoing, but it is something that should be in there even if it is happening, which is strange it's not. Maybe we've missed it because it's already happening. But the other points that you made, we did have the youth council on our list, but we didn't have the Send Youth Council, the Children Care Council. That's really useful. Secondary schools, when we did our last Reading Road consultation, we managed to get Engage, which is the website that we use, to reduce the age limit to 13. So people 13 and above now can respond to consultations, so we can get those involved as well. And we've got, obviously, our My Journey team work with as many schools as they can. So they've got a lot of contacts who, for Reading Road area, they've obviously sent out to all of those schools. But when we go out to the LCP4, we'll be reaching out to them again. And hopefully we'll have a couple of officers going around presenting at the secondary schools as well. So that's good. But yeah, no, it's a really good point about nurseries as well and going sort of further forward. That's good, thanks.
Bill, you want to say something?
Thank you, Chair. Yeah, really just to say how important this consultation is, and to say that this is really pressing for charities and residents that are using charities about our transport system and how we can enable people to access care and support services, whether that be statutory or whether that be charitable. So just, I think that there will be many people that will be interested in participating in this engagement undertaking. And there's many people that are listed there that I know we can support you with to engage, and that I believe they will want residents that are using their services to really feed back through this consultation. So an absolute undertaking from me and commitment from me is to get the message out that this is going live on the 18th, so that you can optimise the opportunity to obtain feedback. Thank you.
Thank you very much. Alice?
Thank you. Just to say, what I would like to see is things in different languages, because one of the things that doesn't happen, that I'm not aware of, is in Wokingham is materials in different languages. I know they did a lot of work when the Ukrainians and the Hong Kong community came in, but apart from that, there are other communities in Wokingham that I would appreciate if they are in different languages. And one of the ways would be having a plugin into your website going into different languages. That could be a way in to encourage people, because I do think, we all assume everybody speaks English.
Thank you, Alice.
Yep, that's a really good point. I'm going to look to Steve because I think we have discussed it with comms, haven't we? But I can't remember what the outcome was.
I can't remember the outcome, I'll be honest with you. But I certainly think that the idea is a very good one and a very useful one, and I suggest it's something we explore on how it's best achieved. Yeah,
So-
as Rob says, the intention is to go in and to contact the various faith groups, the minority groups within the borough, talk to the people who care for people with extra needs, to find out so that we can learn the experiences that they have moving around and through the borough and what the barriers are to their movement. And we hope to incorporate their suggestions into the policies when the LTP moves forward to adoption, which hopefully will be in the summer.
Thank you. Sarah?
Thank you, Chair. Hi, I'm Sarah. I work for the Integrated Care Board, and I'm the director leading for Wokingham, Reading and West Berkshire. Really interesting to read through this strategy, and I'm really pleased to see the links to kind of health and wellbeing and the impact that travel and transport has on that as one of our really important building blocks of health and wellbeing. There was a couple of questions I had, one of them around air quality, and again, really pleased to see that there's commitment to sort of tackling areas of poor air quality. I wasn't clear from reading the document what the specific interventions might be to help with that, so that might be something that comes through in further iterations, but pleased to see that it's mentioned. And my second question is around how much have we considered accessibility to health services from particular areas, thinking of our retirement care home areas and making sure that they're able to easily access services such as GP services, pharmacies and onward routes into hospitals.
Okay, the LTP is supported with a report that has sought the evidence from various reports and other data. But what that evidence obviously is missing is the personal experience and the barriers people are experiencing and accessing healthcare services and the like. So that's why we want to make sure that we really go deep into the opportunities to engage with people, to have those one-to-one opportunities to talk to the carers, for example, who are caring for people, find out what their barriers are. So that's why we need to do the engagement and why we recognise that when we did an engagement piece in the spring this year, and that's where we learned that 60% of the responses were people over 55, 95% of those were white. Whereas we got 0.5% response from those under 24. So this is why for this part of the LTP, we want to go in and actually talk to people to try and reach those hard to reach groups, the young people, the people who worked, who do the 9 to 5, and also, as you see through the current slide, to go through the Health and Wellbeing Board and other boards within the council to talk to CLASP, Dementia Alliance, those sorts of groups. Not necessarily the people who run those groups, but the people who are members of it, the people who have the day-to-day experience of going through the borough. And then from that, we will formulate the policies that will then fall out into the LTP. The LTP itself, the shape of it is slightly different from the last LTP. The LTPs traditionally have been a big, long list of schemes, whereas the current guidance from the council seems to be more setting a policy framework from which detailed studies and detailed schemes are produced at a later date. So you see the bulk of this when you go through the action plan. There almost leads into setting policy rather than being specific policies themselves, and you won't see a big long list of schemes in there either. So the LTP, based on the current government guidance, which they still haven't formally published, is suggesting that really the LTP is more about setting a framework with some policy hooks from which detailed measures can then be determined.
Okay, thank you. That's helpful. And it's obviously really important that we're getting the feedback from residents in the borough. I suppose there's probably also some analysis that we could do alongside that. For example, the location of bus stops to nearest location of care homes and a commitment that it's not going to be more than X distance, just in case we don't manage to get that feedback from people that might be struggling. So I think I'd be really keen to see that. And in terms of reaching out to the communities, if you want an offer to use our comms routes as well through the NHS to kind of get that feedback as well. So I'm very happy to help take that forward.
Thank you very much.
Thank you, Sarah.
Oh, Sorry, Dave, just to come back on the air quality question as well. There's obviously an air quality action plan for each of our air quality management areas. Which is actually being refreshed at the moment because DEFRA asking for our sort of a new version. So there will be a lot of new measures actually in the air quality action plan that don't appear in the LTP, but they're obviously all linked sort of to all of our actions.
Thank you, Debbie.
Yeah, glad you're kind of tapping into carers. I think that's really important. I suppose the other area that you could access are your community navigators that are based, whatever their name is, but social prescribers that are in our GP practices, but in the council as well, because they are people who are working frontline with people, trying to get them engaged in different groups within the community. And often the stumbling block is I have no transport. So I work in Swallowfield. So everybody has to go into Reading and back out again. I also live in Finchansted, so it's only one bus an hour. So, but you know, trying to get our Swallowfield group to different groups is very, very difficult. The other people that might be worth talking to are your volunteer car people as well, because yes, they are, you know, providing transport, but they may have some input in why they're needing to be used.
Thank you.
Yep. Yeah, no, got nothing to add really, but thanks. Written that down.
Okay, have we got any more questions about that? I think it's just to note it, isn't it? Yes. So certainly we'll note it, and you know, thank you very much for bringing it to us. And hopefully people will go on looking at it as well, because you know there's a consultation starting on Monday, so there's 9 weeks for us to bring up our ideas and so on, and also ask other people to do that. And as you said, especially people who aren't like us, well, like me anyway, white, middle class, and over 60. So you know, get some younger people and things like that doing it.
Yeah, thanks very much. Just to add, although the consultation ends on the 18th of February, if some groups obviously only meet occasionally, we're obviously happy to meet beyond that deadline. We can still feed that into the report.
Thank you.
Can I add also that we'd welcome any further suggestions on who we should engage with. So if the attendants here this evening would be able to email us with suggested groups, we can add those to the list. Obviously, we will be time constrained when we do the engagement, so we may need to prioritise. We may not get to meet one-to-one with all these various groups, but we're certainly striving to get as broad a range of voices from the borough to inform the LTP as we can. So, yeah, thank you.
Okay, well, thank you very much for that, and certainly it's good to bring it to this group, because you know so often people work in silos, and it's making sure that the silos, yes, get moved out, because it does affect a lot of certainly the people who we're here to serve. So I think that's very important. So thank you for coming. But I think it's Andrew Statham about the.
Hi, thanks, David. So I'm Andy Statham. I'm Director of Strategy at the Royal Berks, and as of November, I'm also the Director Lead for our work on the new hospital, working with Ali, who I know who's been here several times before. I thought it's useful to provide this group with an update on where we are with building Berkshire Together, our new hospital work, as we recognise that it's been a bit quiet. That's reflective really of the national programme focus, which has been focusing on ordering schemes in light of being asked to take on the hospitals with rack concrete, but also about their focus on repeatable design, which they are very strongly of the belief that by doing that, it allows people to go much faster and for the building sector to be able to respond. I think the key issue for us at the moment is about securing alignment and support for a whole new hospital, and then understanding whether that new hospital can be built on the current site or what possible other sites are available for us. And as we move into 2024, we will be doing some work both internally but also with the community to understand what the impact might be if we were not to remain on the current site. What that impact might be to users of healthcare services, to our staff, to partners, and then broader into the community, and also to update some of our assumptions. We definitely have issues, as we've already talked about reaching all the communities who use the services. Those we exclude with lengthy online technical documents. And I was really grateful already for the input about those groups who are actually going to be the principal users of this hospital in the 50 years from 2030 and onwards. So that's been really helpful. The final thing I would say is that we've got some dates in early January and early February for councillors and members of this group, if they wish to come and see the current state of the estate, to kind of understand what we're working with and what our staff are working with to help that as we start to build that momentum and case for the new hospital. And I'm happy to take questions and reflections from the group.
Thank you, Andrew. And certainly it's quite a thing. And we'd love a new hospital in some ways, but where's it going to be? And if it's on the same site, that's very hard to knock down the old and build the new. But on the other hand, if it's a new site, that means a lot of transport and things like that, and positives and negatives. Let's put it like that. So one thing that certainly I've heard is that the old site is got a lot of underground works under it in tunnels and things like that. And is that something which is limiting, or is that something which can be overcome?
So we are doing work as it's in the public domain to understand what the site looks like and what's there. I'd say that you can build things on anything, right? You can build things on marshes if you have to, but it does make it more complicated if you've got different geological features. So as I said when I was saying, that is the work we are doing now to understand whether you can do that, and the relative merits of doing it. But it's not just the land. The very presence of the new hospital's repeatable design makes it. You have to think about how you do that on a brownfield that's already live working, and that's one of the things that also goes into that. Does the current site work, and into that trade-off discussion?
Thank you.
Yeah, it's a difficult one, isn't it? And car parking always comes up as well. Where would you put that? I suppose in the current climate, we're working with both health and social care when we are absolutely rammed and there is nowhere for anybody to be put in a bed quite often. I can't get my head around having to make space on the current site, so i.e. reducing further our current bed state in order to start building.
There are complexities of building on a live site. Yes.
True.
Describe your current site as interesting. It has so many components, some of which I have visited over the years. I've had my children in your maternity unit, and I visited the eye clinic, and my daughter worked in the eye clinic for a while. And I've just been for breast screening, which is across the road from the hospital and so on. But it's one of those things where people won't like the change. It will be difficult, but I think, honestly, I can't see how you can redevelop a hospital alongside a live hospital. I fear, however, that the way that this programme has been handled to date, if I can put it like that, nothing to do with you, but various decision-making components, and then the sort of left field bit about the RAC hospitals, this may never happen at all. Never mind, even it may be confined to a partial rebuild. It may, and that must make life very, very difficult for you, because there must be things that actually need doing now, and you don't know how long you're going to have to wait on your current site, or whether it's worth doing it. So I think I sympathise with you entirely. I think that I would support a move to a new site, because I think you can get over some of the great difficulties that you have at your current site, and particularly with transport there, because of the transport links are not great, having to go through the centre of Reading to get to things. The car parking is limited. Not that I'm in favour of lots of car parking, but it's an inevitable feature. But I am not sure how you plan for something which may never happen and has a constantly kind of changing thing around it. So I don't know when do you think you will have more certainty? I suppose that's my question. Do you think there will be more certainty, or do you think you'll have to wait for a general election and a new government, whatever complexion that is, and then a revisit? Is it that sort of situation?
So I think the engagement that we have from the new hospital programme, they are very clear on creating a long-term capability and long-term plan to rebuild hospitals, regardless of the political environment, because they recognise the capital investment, not just in the Royal Berks, but we are here talking about the Royal Berks, is absolutely necessary. So that's the assurance that we can have. I can't, what happens as a result of a general election, who knows? I think we will want local support as we approach that, to help all parties understand the importance of capital investment in hospitals, and creating hospitals that are fit for the future. And that's that's the agenda that we want to take. We'd much rather get involved in that discussion than in a tit for tat about where the hospital should be, and that's destructive to what our community needs. So that's my kind of ask in the political space. We need to keep pushing into that, making that case. How it's done, is it done through a great big central programme, or is it done in a different way? That might be what changes. As for site, that we have a jigsaw puzzle of how it could be done. As I said, it's challenging. The other thing, though, that we do want to do this work about understanding what it means for people if we're not here, because the one thing that we can say about our hospital is that it's currently located next to the most deprived parts of the community that we serve. and that's not necessarily true of alternative places that we go. So we really need to understand the extent of that and what you might do to mitigate it if you were not on that location.
And is part of your consideration whether you could leave something on that site and move most of it? So you had, for example, an urgent care facility or something on that site?
Yeah, that would definitely have to be part of the consideration. The real question is what. So I'd really like to understand, for example, do we have a very high number of contacts from the most deprived communities who are renal dialysis patients? Because if so, what you'd leave on the site would include a renal dialysis unit, or what? So that it's the kind of the nuance of what is it that people are coming for from those communities, so that you can help think about that mitigation.
Thank you.
I can see this is even more complicated than trying to do children's services.
Ingrid.
Thank you, Chair. Good evening, everyone. Just a quick, I'm sure it's already in your plans, Andy, but just to raise that Basingstoke and North Hampshire Hospital are also undergoing a consultation about moving their hospital to the other side of Basingstoke, and that will affect your population boundary. So just making sure for the board's assurance that you are considering that variable within all of your work.
Yes, and we're also conscious that Frimley Park Hospital is also part of the new hospital programme. Yeah, myself and my peers have been meeting in the past month and continue to do so.
Great, thank you.
Thank you very much. Oh.
The last one. I suppose the other thing is that this isn't anything new. It's been done in the past, you know, and it's learning from other areas, isn't it? I'm originally from Plymouth, and there were 3, 4, 5 hospitals in Plymouth at one point, and now there is one hospital that's out towards the moors, you know. So it has been done, and it's just learning the good and the bad points of doing some of those things.
Yeah. Yes, and you know, this is a real advantage of the national programme. I think so. They have produced 96 lessons for trusts from what could go wrong and what you need to think about, which I'm promised we'll get. So yes, really important.
Okay. I think that's everyone. Thank you very much, Andrew. And certainly it's very interesting for us, I think anyway, to know how it's going on, so because it is something which is important for the people, you know, for our local population. So, and it's also, you know, dare I say it, friendly for people who live over in and working without and so on. It's there as well. So,
thank you.
Thank you. I believe it's you, Ingrid, now with the West Berkshire Protection and Resilience.
I think it still might be me, Chair.
Oh.
Because I think I'm also talking about the day-to-day performance of the hospital briefly, if that's okay. Sorry. I'll try to do it. I'll try to do it quickly. So what the board here has in front of us is our public performance report to October. I'm not going to go through all the slides. I think I'll draw out the key messages. So we have seen strong sustained progress in reducing staff turnover and improving our vacancy position. And that's the result of a really focused campaign in the first 12 months of our work on this area, and that's having some real sustained impact. We've also started to see some positive turnaround around some of our diagnostic weights, with some new capacity that we've invested in, and some additional effort from our radiology teams. But there are areas of more challenge, particularly around the emergency department performance, related to both the volume of people seeking care and the challenges of discharging patients and therefore creating capacity to admit them, which I'm sure Matt will be able to contribute to. There's also a growing concern. We have a growing concern about our ability to meet the increased ambition around waiting targets next year. That's a combination of staff availability, demand, and financial constraints that we're expecting. And so both of those two agendas are the focus of our board in thinking about the settlement that we come to with ICS colleagues to support those challenges, and more importantly, getting into the prevention agenda that provides some of the long-term solution and mitigation to the demand that patients are presenting with at the moment.
There were any questions?
No questions, just comments really. Particularly with the urgent care, we all know it. It's, in primary care, it's really, really busy as well. And the urgent care board have been kind of looking at different ways of basically clinicians accessing urgent care, and rather than everything going through front door, using same day emergency care, which is more medical, and also same day surgical care as well. So patients are going straight to an acute ward rather than having to go through A&E, which is better than patient, and obviously kind of tries to reduce some of the numbers in ED, and that's been really well received. They're also doing some work with, particularly at the moment, with out of hours and the ambulance colleagues of it's called Call Before You Convey. So there is a consultant number that can be rung in ED to ask advice about, actually, do they need to go in? Where do you need to be sending them? So behind the scenes, there's quite a lot of initiatives of getting the person to the right place without just stacking everything in the ED department. So thank you.
Thank you, Debbie. Prue.
Someone here, sorry, I can't find it now, but there's a bit about a target about where you treat people, and then there's a comment about how using the other units, like Newbury and Thatcham or whatever it is, I can't remember the exact ones, but different units seems to be seen as a bad thing. But if people get seen more quickly, is that not a good thing? The fact that you can't treat them close to the site is not necessarily a bad thing?
That if that's the interpretation that comes out of the report, that's entirely not right. Like the objective is about how we deliver on bringing care close to home and making use of our other sites where it's appropriate to. And I think what we're challenged by at the moment is having made quite a lot of progress from 2017 to 2019, we seem to be a bit stuck in really pushing that agenda further forward. So it's something we are thinking about. Why are we stuck?
It's a shame I can't find it now. I should have marked it up in the document, but I haven't done. It's one of the things with PDFs and not be able to comment in a large, big, bold thing that I can find again.
I think I can help you with that. Though it was in the report, and I think it was trying to use Newbury and Henley, but some patients don't want to travel that far. They want to be seen local to home. And is you can absolutely be seen more quickly in some of the tertiary sites. But I think that will probably come back to communication, possibly from the GPs, to say you can be seen here, here, and here, but you could be seen quicker. I usually say, well, it's a walk-in service at the Royal Berks for an X-ray, but you could park really easily at Thatcham and it'll take you the same amount of time. So it's how it's kind of communicated with the patients, really. So I think we all have to be on board to use all of the services rather than just funnel everybody towards Berks.
Thank you, Debbie. Something that interested me was preventative services and so on. How's that working? Because that must be the objective, to try and get people to either treat themselves or find other ways of working, because the NHS is so high pressed.
Yes, I think I'm happy for Sarah to talk as well. I think that this is a key part of the systems joint forward plan work. I think we are the first bit that's helping us get into that is the systems work on primary care, which I think is something that this board may want to see a bit more about, that's helping us get in there. But yes, we need to do something, and the scale of what we need to do is really big, and don't think we've got the answers.
Having said that, I know that primary care is very, very
right.
overcrowded. My wife is a GP, so I have experience.
I should say that it's absolutely forefront of our mind as a board and exec team about it's our role to provide resource and thought and people into that space as well. We can't just expect primary care and colleagues not working in the hospital to solve it.
Sarah.
Thank you, Chair. Yeah, just to add to that and build on what Andy was saying. So the primary care strategy that Andy mentioned is something that we're working on at the moment, and we're in the first stage of engaging with the public around getting feedback on the current state of our services in primary care. And by primary care, I mean general practice, dentistry services, optometry, and community pharmacy services. What's emerging in that is that there's clearly a huge prevention stream, and how do we enable our primary care services to really focus on prevention as well as tackling kind of present demand, so that we can hopefully shift the dial on some of the trends that we're seeing in terms of prevalence of long-term conditions and people not being as healthy and as well and living as long lives as we would hope that they can do. And that's also linked to the work that we're hoping to progress as a place partnership, which we've started on with the community wellness outreach work that we've spoken about here in the past. And I'd be really keen that we bring an update again going forwards as that rolls out further into Wokingham in the new year. But that's kind of just the starting point, and the ambition really is to say, well, how do we come together as public services to really take a preventative approach, looking at all of the building blocks of our health and wellbeing in a way that we haven't done historically.
Debbie.
So for me, once you got to primary care services, you've missed the point. If we are really talking about preventing people becoming unwell, we need our educational services to talk about, healthy lives right at the beginning. We need families to talk to each other and support each other. We used to have a granny that used to tell you what to do, actually give some Calpol was usually quite helpful every so often. But we also need the national teams and comms services to be giving those messages. There's usually a kind of almost like an annual comms, leading up to Christmas. Hopefully you'll see, get your medicine kit ready, if you've got a cold, do this, and all those kind of things. So yes, we think we need education involved. Yes, and we need sport and leisure available and transport to get to them. But we also, need our national teams communications to support us for people to take responsibility for themselves.
Thank you, Debbie.
So I went to the National Children and Adult Social Care Conference, which was very interesting, and we had a presentation from, forgotten her name, Amanda, whatever, the NHS England lady, who, in contrast to last year, actually made quite a good speech about public services and how we were all going to sink or swim together, and we have to work in partnership. And it occurs to me that this prevention side, what Sarah's describing as looking at pharmacies and whatever, how engaged in that, or how much have you engaged our public health side in that? Because this is absolutely where the local authority and the NHS meet, isn't it? And so it's about how we are making the synergy out of our two halves to actually progress that. Can you say something more about that?
Yes, I can. So in terms of our local partnership, public health is very much part of that. Ingrid and I are regularly talking and brainstorming at how we can really kind of grapple this together. In terms of the primary care strategy, there was involvement from public health, but I think actually we could and should be strengthening that further. So part of this consultation period, I'll be really looking to feedback from colleagues, including Ingrid and the public health team, on how the draft is landing and how we might want to shape that before it becomes a final strategy.
Thank you. I think this is just a note, but certainly, again, it's very interesting to have these figures and so on, and to look at them. And yeah, it's something which we want to go on looking at. But it's great that there's some positives as well as perhaps some not so good things. And as with everything, there's budgetary constraints, which mean that we can't. I'm sure, can't do all that you'd like to do, Andrew. So thank you very much. Okay, just about at the end now. We're just looking at the forward programme. Pardon? But what? Sorry, Ingrid, it's your item. It's the Resilience Partnership.
That's quite all right. Yeah, I won't keep you long at all. This is an item just for the board to note, if that's okay, but happy to take any questions. So just as a short background, as you all know, the local authority's got statutory responsibilities around health protection and emergency preparedness. And in this context, health protection includes all activities seeking to prevent and reduce harm caused by infectious disease and minimise impact from environmental hazards such as chemicals and radiation. So it's quite a technical aspect of public health, and other colleagues across the local authority and the wider system. Directors of public health act on behalf of the local authority to discharge many elements of these responsibilities, working in collaboration with partners across the system. Prior to COVID, there was a system in place for directors of public health to have that assurance across the system. That was done on a Berkshire footprint with the single DPH at the time. During COVID, as you might imagine, all of those systems were sort of co-opted and changed during the course of the pandemic, and since the pandemic have never been re-established. And public health has changed a lot across that time. So what has happened in the last 6 months is that this gap around assurance, particularly for this statutory function, has been recognised, and this board set up for Berkshire West footprint. It's called the Health Protection and Resilience Partnership Board. The terms of reference are included in your pack, so hopefully you've seen those. So it's about asking, it is a constituent group reporting into this Wellbeing Board and also into Unified Exec for the ICS. So if everyone's happy, it's to note the reformation or the formation of the Berkshire West Health Protection and Resilience Partnership Board, its terms of reference, and to know that we will be reporting into the Wellbeing Board frequently but formally on an annual basis from that board. But happy to take any questions.
Thank you, Ingrid. Is there any questions?
I have a question. I'm quite happy with the arrangements and the annual reporting and so on. The bit I don't understand, and maybe somebody can tell me out of this, is we've got the United Executive, which is, it says in brackets, Strategic Board of the Berkshire West Place-Based Partnership. Fine. What is the mechanism by which we keep us informed of what's going on there?
So Sarah might, that would be Sarah. So Sarah runs the Unified Exec. So yes. Sarah and I and Matt all sit on the Unified Exec. But there's probably a formal
I don't know that there is. That's the thing. So it would be nice if we could check whether there was a sort of an annual update required. Not that you won't do it more informally, but I'd like to have something in writing that says that we're kept aligned somehow. Yep.
Sarah?
I was actually, you preempted my comment on the forward plan, and I was going to suggest that maybe at the March board we bring an update from the Place Partnership, which Susan sits on as well. So it's a kind of an integrated board of the senior leadership across Berkshire West.
Okay, thank you very much. Anyone else got any comments or questions? And thank you, Ingrid, and we'll be hearing from you, I'm sure, keeping us up to date. So that's good. Okay. We go on to the forward programme. Looking at this, we've got the 2 safeguarding partnership boards in February, as well as GP performance, and our usual Royal Berkshire point. So I think that's quite full, isn't it? So I don't think we need any more. But in March, if we have the place partnership, as well as the pharmaceutical committee, the pharmacy, optometry, dentists, Marmot, and the Royal Berks, that'll be quite a bit. And that's, I don't think we need to add any more unless anyone's got anything urgent to say. But certainly, I mean, I like to keep these meetings for an hour, but it's been nice to have an hour and a half. And certainly, Social Care Futures deserve time at the beginning of this. And I think all of us, even though some of us know quite a lot about it, all of us got things certainly from Callum and Jay, as well as, about the whole situation. So I think that's important. So thank you all very much. Has anyone got anything else they want to add to the agenda?
Can I just follow up on that? No disrespect to any of you, but having those guys in earlier made this meeting the most uplifting meeting I think I've been to for a very long time. So thank you.
It's great, and that's what we want to go on doing. Having users involved, because we can say what we like, but if we don't really know about it, it's listening to people like that really matters. So thank you all very much. Sarah, sorry.
Sorry, Chair. I was just going to say, for one of the upcoming agendas, it would probably be helpful to bring the primary care strategy, and we could align it with the pharmacy, optometry and dental update. I think that's already scheduled, but we'd be really keen to bring that through this board.
So if that comes to March, would that be?
We'll check the timing, but I'll speak to Madeline about the best timing for that.
Okay. I don't think anyone's got anything else. So thank you all very much for being here, and thank you for all that you've given. And yes, and it's been great to have Callum and Jay, and I hope that we can go on having people like that, users involved, because that's part